Clinical experience. Among many pre-meds that have been accepted into medical school, clinical experience is a very key part of many applicants. In this video, we're going to talk all about clinical experiences, from what clinical experience is to different forms of clinical experience. If you're looking to get clinical experience and think any of this is going to help, a like to the video and a sub to the channel would be awesome. What is clinical experience? Let's break down what clinical experience really means. Simply put, any experience where you're directly interacting with patients qualifies as clinical experience. So, if you find yourself in any role that involves patient interaction, whether you're taking medical histories, measuring vital signs, or even assisting in basic patient mobility, you're engaging in clinical experience. Now, you might wonder why it's necessary before medical school. The truth is, many who aspire to become doctors haven't really experienced what it's really like to work closely with patients. Gaining clinical experience before medical school ensures that you truly understand and are prepared for the realities of patient care. This is vital because it confirms your commitment to and passion for the medical profession, reducing the chance that you might end up unhappy with patient care in the future. The first option is medical scribing. As a medical scribe, you work closely with physicians, accompanying them during patient visits. Your primary responsibility is to document all interactions in real time, ensuring accurate and thorough medical records. This role offers a front row seat to the daily operations of healthcare professionals, from diagnosing to treatment planning. It's an exceptional opportunity to witness firsthand how physicians manage patient care and make critical decisions. One of the most significant benefits of being a medical scribe is the close relationship you can develop with your supervising physician. This relationship can evolve into a mentorship, giving you access to personalized advice and support, and potentially a strong letter of recommendation for medical school. However, it's important to note that while this role is rich in observational learning, the interaction with patients is primarily indirect. If you want a bit more hands-on experience, being an EMT is a great option. EMTs are first responders trained to manage a variety of medical emergencies. From the moment they receive a call, EMTs are on the front lines, providing critical care during transport to hospitals. This includes administering CPR, controlling bleeding, and using advanced equipment to monitor and stabilize patients. Training for an EMT certification, which you must pay for, can vary anywhere from 8 to 16 weeks. Many opt for hybrid programs that combine online learning with practical hands-on training, making it feasible to balance with a busy academic schedule. Once certified, EMTs have the option to work in paid positions or volunteer. Paid roles often involve non-emergency transport, helping to move patients who are stable but require professional oversight. On the other hand, volunteering typically places EMTs in a more dynamic environment, responding to emergency calls that can range from routine medical issues to life-threatening situations. Working as an EMT offers experience in emergency medicine, exposing you to medical scenarios that can enhance your skills and understanding of patient care. However, the role can be emotionally demanding, as EMTs frequently encounter critical situations and even death, which can be challenging for some. Clinical research is interesting, as it touches on clinical experience as well as research, which we have made our own separate guide on. By doing clinical research, you're basically knocking out two birds with one stone. As a clinical researcher, you'll typically collaborate closely with a team that might include PhD students, physicians, and other healthcare professionals. This collaboration not only exposes you to advanced medical research, but also allows you to develop meaningful mentorships that can significantly shape your career path. In this role, you'll be directly involved in the development and execution of studies that assess new medical treatments, interventions, or technologies. This will often include patient recruitment, data collection, and analysis, ensuring you have a well-rounded experience that combines theoretical knowledge with practical skills. One of the great advantages of clinical research is the opportunity to develop your communication skills and understand patient care nuances firsthand. Additionally, clinical research positions are often paid, and if they aren't, there are usually opportunities to secure funding through research grants or stipends. Most importantly, the relationships you forge during your time in clinical research can lead to excellent letters of recommendation and a professional network that supports your journey to and through medical school. If you're already following these steps and have landed yourself a clinical experience, you're doing great. However, in order to effectively use your clinical experience as a competitive addition to your medical school applications, you have to ensure that you maintain continuity in your experiences. Generally, to be competitive as a pre-med, you should have around 1 to 2 experiences that each range from 6 months to a year in length, with at least 100 150 hours to stay competitive. Just to clarify, this is simply a guideline and you can still be successful with more or less involvement. With that being said, that wraps up this video on the ins and outs of clinical experience. If you're interested in learning more about clinical research opportunities, join our undergraduate admissions Discord server found in the pinned comments. And if you found this video helpful, make sure to leave a like and subscribe so you don't miss out on any helpful and entertaining pre-med content.